So what's causing this? I think a number of things. You know, we've got a horse who's gotten lamer in the last 8 weeks,
Right.
on stall rest and walking. So do we trim his heels down too suddenly? That's a possibility. I know that's a short, simple answer. Should that last 5 weeks? No, it should not last 5 weeks,
Okay.
especially with getting viewed after the last trim. And apparently, it doesn't. Nobody's saying he's worse today after the shoeing than he was a few days ago.
Right.
I haven't had a chance to see the video yet, but my impression is that he's the same before and after his shoeing.
As far as I can tell.
Okay, so we're agreed on that. So our issues are right hind lameness. Dr. Banner mid-August found him to be only lame on the right hind, very slightly after flexion tests.
Okay.
And yet today we can see that he's off on his right hind. We need to separate that out somewhat from left front, but I think everyone's agreement from short trot that we've got a right hind issue as well as a left front.
Okay.
So to me, the things to do first would be to, and then we've got the very painful neck, and we've got the failure to lock of his carpi. Is that secondary to pain, or is it a neurologic problem? So first of all, I think we need to start getting rid of some pain. We're going to have to do, unfortunately, some trotting work to get this done, and he hasn't been trotting, and so we're going to have to be careful, and this was true in August too. One thing to do, we know we've got a left front lameness, let's block it out. And I would do, I'll defer to Dr. Banner to an extent, but I would probably block his foot pastern, just to roll that
nerve
out.
blocks at this point?
Nerve blocks.
Okay.
Yeah,
Gotcha.
and work your way up to localize where the
Yeah, block out his
pain
check
is.
ligament and then see if his neck is still sore. You know, if he goes around for 20 minutes with a pain-free left front lower limb, does the neck pain resolve or stay the same? Dr. Ridgway is saying it's not clearing with acupuncture, which is usually pretty good, but it's not quite the same as blocking the pain out totally. Now, he's resolving the inflammation, but it's
How
not.
long after you block it would you expect him to go pain-free in the neck if that were
Probably 20 minutes or so after
that's
being,
it? Okay.
not pain-free, but he certainly should have a way less dramatic response to pressure on his neck than he does now. And then, not stopping there, unfortunately, and we may set his check ligament back, but you're saying, this is going on a long time, and I agree. So if we're going to get to the bottom of it, we may have to inflame his check ligament to do a good enough lameness exam to figure out where the source is sore. So if he blocks out to his left front and we're getting the front end, then we need to look at the hind, not stop there. We need a whole horse evaluation, and we probably need to block his right hind.
Okay.
If we can find a sore enough spot.
Would you
to
do
block
this
that.
simultaneously, like same day,
One
or is
session.
it? Okay.
Because you got the left front blocked, you got to do it while the left front is blocked.
Gotcha.
If it's the primary lameness.
And did you want radiograph
So,
of the
of whatever you find.
whatever she thinks? Okay.
Whatever it's localized to. So that would be my plan of attack. And again, that will help us decide. If you block the front, does he stop popping his carpi? Or does he keep on doing it? Or, after he's been blocked for a little while and he's comfortable, is that a guarding thing that he is consciously kind of doing? Or is that an inadvertent thing? If it's an inadvertent thing, I'd be testing him for Lyme disease.
Okay.
So,
How long do those blocks normally last?
be up to 2 hours, but really clinically probably 30 minutes.
Okay.
So you'd have to move along with your plan. And the other thing is possibly radiographs of his cervical spine.
That would have to be done at a university, wouldn't it?
It depends. There are private practices that have the
I don't think we
equipment
have
with
any
the
in
punch,
Charleston, but I could be
but,
wrong.
to get through there. So, those would be things to look at. I know that Dr. Carter's practice in Aiken can do cervical radiographs, and I think Dr.
They
Jacobs
can.
can
Okay.
do cervical radiographs too, but I would certainly investigate that to be
Yeah.
sure. But those are other, I'm not seeing anything on the periphery,
Okay.
but I'm not seeing his central spine.
Okay.
And so usually in that sort of situation where you have joint and soft tissue, you want radiographs and ultrasound. They're two sides of a
Okay.
page. So
right.
I know Dr. Carter is the other side of that is cervical spinal problems are flavor of the month, and everybody's injecting the heck out of them. Oh, it looks bad. I only recommend having them injected if I see a fusion in a joint or arthritic change in a joint. I'm not seeing either one of those things.
So I'm assuming if we have radiographs, they would send them to you, and you would make.
Yeah, or they
recommendations
can look at it too, but I can help you with avoiding over treatment.
So they would normally not have seen the ultrasound portion of it, right? So if you need both pages to
Right,
make the proper
right, and
date.
I can send them back and forth, so we
Okay,
can,
gotcha.
you know, certainly those can go 2 ways. You get all the image. I actually, because it was normal, I didn't take ultrasound images of it. I
Okay.
usually do normals, but I will write down that it was normal on
Gotcha.
ultrasound.
Okay.
So that would be a deeper kind of a thing if there is a cervical involvement. Dr. Ridgway is very good at that.